I'm looking at my CT scan. This one here on the right is from March 2022, and this one is from today. This is the heart. This is the left lung, right lung, right lung. This is the tumor from 2022. And that's part of the tumor now, as you can see how big that is, and it's, you know, encroaching on the lung field, but now it's smaller. There's still tumor there, but compared to now, March 2022, you see how bigger that is compared to now. So that's a good thing. Look at that. And part of that tumor actually extends to my IJ and brachiocephalic and the vena cava right here. See, that's part of the vena cava in there. So the tumor is going into the superior vena cava. But see how big the tumor is back then, and now it's much, much smaller. Hi everyone, I'm here in UCSF getting my MRI and CT scans. I've had worsening symptoms. The pains are worsening in my bones, and I also have this neuropathy in my arm and in my right thigh, and part of the involvement is the muscle too. So it's likely pathological fractures from the bone metastases to the lumbar vertebra. This is an MRI of my lumbar spine. The one on the right was from July 2022, before my surgery. As you can see, that's a lumbar 3 vertebral body. There's that looks like a hole there, and I think this now right here is it's cemented. I don't have a read yet of today's lumbar spine, and this is what I'm worried about and asked for the MRI because of the symptoms that I am feeling. I still refuse to take any pain meds. I'm putting something topical when I am not really doing anything. However, when I move, running, swimming, biking, my mind is onto something else. So I need to get myself busy to not be so focused on the pain. Now, this is the MRI of my abdomen, and we're going to look for any metastases to the liver, the kidneys, pancreas, adrenal glands, and the good news is there's really nothing there. There's no spread of the cancer in the abdominal organs. I know to some people who have cancer, this is quite an anxiety-provoking procedure, having scans, because some of them are worried about, is the cancer back? Am I gonna have to go through that chemo again, radiation, and all those treatments and the dreaded side effects? However, for me, it's just a matter of finding out if things are worsening, and sometimes that is heralded by worsening symptoms. Now, this is a PET scan that will show you where all my tumors are. And if you come closer, this is the head right here, and this is my right arm. I have a tumor there, and in my skull there's something lighting up there. In the bones, there's tumor in the skull bones, and in the cervical part of the spine, in the neck, right there. You keep coming down, there's still more. And that's part of the arm right there in the bone. Now this is the tumor in the chest. That's just the beginning of it on the right side. That's in the ribs. See how brightly that lights up. And this right here, this area is the heart, and it's very bright right there. And parts of it here lighting up, that's the lymph nodes, and right there, tumor in the lungs. That's still part of the tumor in the chest. And up here, You have the breastbone. There's tumor there. And on the ribs again, on the left side, on the right side too. Now going back down to the spine, there's more tumor there. That's rib still. So in the thoracic part of the spine, there's tumor. That's rib on the right side. There's tumor. The lumbar spine, there's tumor right there. You see there's like a hole in the bone right there. And keep going down. There's more tumor. And now in the sacrum, in the pelvis, sacrum. That's pelvis tumor. That's part of the leg bone, the femur, on the left and on the right. The goal for me is stability. All of these cancers are not going to go away. So it is a given, and I know it, that eventually I'll need radiation and targeted therapy and possibly chemotherapy in the future. But the goal is to not have that for as long as we can. And as long as the cancer is stable, I think we're in good shape. You can see it's pretty widespread. However, as of today, we know that it's pretty stable, I think, which is a good thing. I'm leaning towards the very real possibility that we will continue holding treatment. And as far as the back for my spine, and I'm having a lot of pain, I don't know. We will find out what the read is, and we'll go from there. Okay.